Hi, Josh with Text Expander. I want to address a serious issue in healthcare, and that's the use of abbreviations in medical documentation, which can lead to some serious errors. You're probably familiar with do not use lists. They're pretty common in most practices. For instance, you don't want to use the abbreviation IU for international unit because that could be misinterpreted as IV, short for intravenous, and vice versa. You don't want to write MSSO4 because that could be confused with MgSO4. Those are two very different things. One's morphine, one's magnesium sulfate. And this is a very serious issue. One study performed in Pennsylvania reviewed 103 critical incidents and found that 56% of them involved the use of dangerous abbreviations. 56%, over half of the critical incidents in this review were caused by abbreviations. Another study, they had 46 volunteers that evaluated abbreviations in medical notes. The maximum score achieved, they guessed the abbreviations correctly, was 60%. The minimum score is 10%. So if you use abbreviations in medical notes, there's anywhere between a 40 and 90% chance that someone misreads your notes. But of course, many of you use abbreviations anyway. Why? Because you have to take copious amounts of documentation. You spend up to 6 hours per day in your EHR. It takes up a great deal of your time away from patients. So of course, it's tempting to use abbreviations. A recent article says that 1,000 physicians surveyed, and 93% of them reported feeling burned out. And 49% said their daily workload is unsustainable. So you might feel stuck between a rock and a hard place, between burning yourself out, typing copious notes, giving yourself RSI, and using abbreviations that could be misinterpreted and could cause a critical medical incident. The solution is Text Expander. Watch this. I can type IV and it expands to intravenous, or I can type IU and it expands to international unit. And it's smart enough to know to not expand in the middle of a word. For instance, I can type olive and it doesn't expand. That's the power of Text Expander and medical notes. All the advantages of abbreviations without the risks to you and your patients.